Everyone, welcome to The Explainer. If you've ever felt totally trapped in this seemingly endless loop of physical tension and emotional exhaustion, you are definitely in the right place today. We're going to unpack the actual mechanics of breaking chronic physical and emotional pain cycles using targeted therapy. We'll look at how exactly your body holds on to stress, and much more importantly, how we can scientifically and practically let it go. Okay, let's dive into this.
It's a pretty harsh reality, isn't it? Eventually, that discomfort just becomes standard operating procedure, and your body actually compensates in ways you might not even realize. Chronically, when pain just becomes a part of your everyday life, it subtly but severely alters how you walk, how you sleep, how you work, basically how you live. And it usually starts out so innocently, right? Just an achy neck from staring at your screen all day, maybe tight shoulders, or a lower back that just feels permanently stiff. But before you know it, that discomfort is your new normal. It's your baseline. Your body starts compensating, shifting your weight around, tweaking your posture, and you don't even notice it. But that just exacerbates the core problem over time.
And this brilliantly illustrates the vicious cycle we get stuck in. Step 1, you've got that persistent physical pain. Step 2, that pain actually elevates your emotional stress. Your nervous system literally gets locked into this white-knuckle grip. And then, step 3, because your body is so physically and emotionally tense, inadequate sleep naturally follows. You wake up feeling stiff, fidgety, completely exhausted. And without that restorative sleep, the physical pain just gets worse, and the loop keeps feeding itself day after day.
Section 1. What is deep tissue? Finding the reset button.
So how do we actually break out of this loop? Well, we need to completely shift our perspective here. This isn't just about a pampering day out. Places like Golden Hour Spa approach this as an intentional, bespoke therapeutic intervention. It's a necessary tool that's specifically designed to interrupt that cycle of strain, rather than just being some luxury spa treat. By definition, deep tissue massage is an aggressive technique. It uses slow, deliberate, and really firm pressure. But the absolute key phrase to remember here is deeper layers of muscle and connective tissue. This is fundamentally different from a generalized, light-pressure relaxation massage that just kind of grazes the surface of your skin. Deep tissue specifically targets those stubborn problem areas that persistently hold tight over time. It actually gets into the core of chronic tension to forcefully but safely alleviate that stiffness.
Section 2. Healing the physical body and restoring movement and function.
Now, what's really interesting about this slide is how these internal physical fixes actually translate to your everyday life. This is incredibly uplifting, especially if you've been battling the repetitive stress of a desk job or deeply ingrained postural imbalances. First off, increasing blood circulation, that's not just some biological buzzword. Fun fact for you, increased blood flow can boost oxygen delivery to fatigued tissues by up to 400% in a targeted area. That directly delivers vital nutrients, which supports your body's natural repair. It also reduces chronic inflammation by easing the tension in those overworked tissues. And by breaking down fibrous adhesions, basically releasing those deep, tight knots that restrict your range of motion, suddenly, everyday activities like bending over to tie your shoes, turning your neck, or even just going for a walk become so much easier. Add in faster muscle recovery and correcting posture-related strain, and you are literally changing how your body moves.
Section 3, breaking the mental loop, relieving stress and anxiety.
Let's move to and see how this builds. Because we all know pain isn't just a physical experience, right? It takes a massive emotional toll. When physical pain feels permanent, your mind simply cannot relax. Just look at the before state. Your body is burdened with those fibrous adhesions, your motion is heavily restricted, and your nervous system is trapped on that exhausting, white-knuckle grip we talked about earlier. Now contrast that with the after state. Once that deep physical tension is actively released by a therapist, your body is flooded with increased oxygen. Those painful adhesions are broken down. And because your body is no longer holding on to all that structural tension, you finally lay the groundwork for deep, restorative sleep. The mind actually quiets down, the nervous system regulates itself, and the pain stops feeling so all-consuming.
Section 4. What to expect afterwards. Practical advice and FAQs.
So, if you're ready to break that cycle, you probably have some logistical questions. I think the most common fear is, does deep tissue massage actually hurt? Don't worry, you are not going to need to bite down on a leather strap or anything, but it is a perfectly fair question. The honest truth is, sometimes the pressure will feel intense, especially when they're targeting those deeply embedded knots, but it should never feel unmanageable. An effective, skilled therapist is going to constantly communicate with you and continually adjust the pressure based on your personal comfort level and what your muscles actually need.
Next up,
How often should you actually get this done? Well, the ideal frequency depends entirely on your unique lifestyle. It really comes down to what you do every single day, how you move, and exactly how much physical pain or emotional stress your specific body is carrying.
To give you a general idea, though, here's a typical progression timeline. Initially, if you're dealing with acute, persistent pain, you might start out with weekly sessions just to get some immediate relief. Then, as your body progresses and the tension begins to stay away longer, you might naturally transition to bi-weekly visits. Eventually, for long-term comfort, monthly maintenance visits usually do the trick. And what's absolutely fantastic here is that this is a safe, non-invasive, drug-free choice. When you pair this therapy with daily hydration, some light exercise, and dynamic stretching, you're building an incredibly solid foundation for a complete pain management plan.
Now, we also need to be super clear about who should hit pause here, who should actually stay away from deep tissue massage. If you've had an injury within the past 3 months, if you have any history of blood clotting problems, or if you're currently experiencing severe inflammation, you really need to hold off. It is absolutely vital that you contact a doctor before booking a session. Always consult a medical provider if you're ever unsure.
Okay, so if you're cleared and you do get a massage, the work doesn't stop the second you get off the table. Here is your actionable aftercare protocol. First, drink water immediately. Seriously, don't even wait until you feel thirsty. Rest if your body is telling you to. And whatever you do, do not head straight to the gym and overload those freshly treated muscles. Engage in some light stretching instead. Oh, and I also want to give you a quick warning. Minor soreness is completely normal. Think of it kind of like the soreness you get after a really good workout. It typically fades within 24 to 48 hours.
So, the crucial point is this. When our pain becomes embedded in the fabric of our normal routine, it might be time to jolt that cycle into question. Please don't let chronic discomfort quietly dictate how you move, how you sleep, or how you live your life. You have the ability to reset your body's baseline. Whether it's through the targeted relief of a deep tissue massage at a specialized clinic like Golden Hour Spa, or just by completely revamping your daily mobility habits, take that step. It is time to ask yourself, are you going to accept pain as your permanent roommate, or are you ready to jolt the cycle and finally take your life